Good afternoon, all, and welcome to our interactive discussion on infectious disease epidemiology. My name is Y.A. Wada, and I'm the course facilitator for this group. In our first class, I gave a general overview and the general requirements as to meet up with the course objective. So in today's session, we will define epidemiology and try to explain the basic concept in infectious disease epidemiology. So after studying this session, you should be able to describe the general approach to public health problem. You should be able to define epidemiology. You should be able to describe the basic principles of epidemiology in terms of time, place, and person. You should be able to describe the basic terminology and concepts of epidemiology and describe the functional role of epidemiologists. You should also be able to describe a public health problem in terms of the agent, host, and environment. And finally, you should be able to identify the types of data sources and basic methods of data collection in order to describe or investigate an infectious disease outbreak. So, before we talk about an epidemiology, let's learn about the general approach to public health problem and how it relates to the public health core sciences. Let's think about public health in a broader perspective. We know public health problems are diverse and involve infectious diseases, chronic diseases, emergencies, injuries, environmental health problems, and other health-related threats. However, irrespective of the problem, in public health, we take a general approach by following four general steps. First, we ask the question, what is the problem? In public health, we identify the problem by using surveillance system to monitor health events and behavior occurring among a population. After identifying the problem, the next question we ask is, what is the cause? For example, what risk factors might make certain populations more susceptible to a particular disease or condition, or something in the environment, or certain behavior that people are involved that may predispose them to health challenges. After we've addressed what is the cause and identify risk factors, we then ask what intervention works to address this problem. We think about what interventions have worked in the past and whether this intervention can be applied to the present situation we are investigating. In the last step, we ask, how can we implement the intervention? Will this intervention really work given our scarce resources and what we know about the affected population? But to implement this public health approach, public health practitioners use and apply scientific methods. And these methods come from a series of core sciences that provide the foundation for public health. And these include first, the science of public health surveillance, which we use to monitor a public health problem. Secondly, the science of epidemiology, which enable us to determine where diseases originate, how they move through populations, why they are moving, and provide us with the data and understanding of how we can prevent them. Later in this session, we are going to learn more about epidemiology. Then the third core sciences of public health is the public health laboratories. They support the public health by allowing us to find a diagnosis for a condition that we are investigating. They also support the public health by conducting research and testing using microscopic, serologic, or molecular diagnostics to tell us more about the identity of the infectious agent. Then we have the science of informatics. The science of informatics deals with the collecting, compiling, and effectively using electronic data to solve public health problems. As we continue to move from paper to electronic health records, the science of public health informatics allow us to do it in the most effective possible way. Then we have the science of prevention effectiveness, which is closely linked to public health policy. Prevention effectiveness studies provide important economic information to decision makers and allow them to choose the best option among possible alternatives. And finally, the science of public health, which is better able to respond to all of the information the other sciences can provide in order to come up with appropriate recommendation as regard the public health problem. So, given these general core sciences, let's take a classical example of public health approach from problem to response using the case of canine rabies or dog-mediated rabies. So take, for example, the public health problem of canine rabies. The public health surveillance can monitor where and when cases of canine rabies are occurring each year. Then professionals can use the science of epidemiology to understand why some population choose to become vaccinated and others choose not. They can use the science of then informatics to get clinical information from electronic record, from doctors' offices and hospitals, or veterinary teaching hospitals or reference lab. The public health practitioners can benefit from laboratory science because the lab can provide and diagnose whether these diseases that are suspected to be causing maybe symptoms of rabies like hydrophobia and encephalitis, whether it's actually caused by rabies virus or something else. This lab can also tell us more about a particular strain of rabies virus that is predominant in a given year, a given population at a given time. And they can use prevention, the science of prevention effectiveness to assess whether a mass dog vaccination or human population vaccination will be the most or might be the most cost-effective way of controlling or eliminating the rabies. So you can see how these core sciences work together in order to provide a solution to a given problem in the public. Okay. So with this background, let's learn about epidemiology and how it aligns with the basic scientific approach and its purpose in public health practice. Um, I'm confident that everybody in this forum is familiar with these three basic words that make up epidemiology. It has a Greek root, epi, which means upon, demos, which means the people, and logos, which means the study. So basically, it means what happens to people or human population. And equivalent to epidemiology in veterinary sciences or veterinary medicine, we have an epizootiology. And usually because an epidemiology originates from medical field or human medicine, and in vet, we tend to adopt another alternative, which is epizootiology, in which regard epi means upon, zoo means animal, and logos mean the study. So basically, it means what happens in animal population that may have health implication to public health. Traditionally, human medicine and veterinary medicine tend to be viewed separately. However, despite their differences, the two professions they have a common interest and share common challenges. They all try to respond to public health challenges. Additionally, now in public health, we tend to look at it as a kind of multidisciplinary field where you have the concept of One Health that involve several disciplines. A mathematician for maybe modeling of infectious diseases. You need the knowledge of the zoologist to tell you more about the biology of the pathogen. You need the biologist to tell you about the ecology of the parasite. You need the microbiology to tell you the identity of the pathogen. You need the vet to tell you more about the distribution of these diseases. You need the medical practitioner to tell you more about diagnosis in terms of prescription of medicine. You need the pharmacist and to tell you more about drug. So it's a kind of a multidisciplinary approach. Okay, so I'm very sure that most of the people in this forum are from different field of the sciences and uh, health related field. So basically, literally, we now say an epidemiology is the study of disease in people population, while epizootiology is the study of disease in animal population. So these two are just literally simple basic definitions. A more concise definition of an epidemiology is that which captures the underlying principles of public health. And the definition is given by Last. If you check Dictionary of Epidemiology, 4th edition, 2001, and is defined as epidemiology is the study of the distribution and determinants of health-related states or events in specified populations and the application of this study to control of health problems. So in line with an epidemiological process, these are the keywords highlighted in the definitions that you need to remember and understand whenever you talk about an epidemiology of disease or epidemiology of condition, or epidemiology of health-related states or well-being of humans or animal population, not necessarily disease condition. So we're going to look at each of these highlighted keywords and how they reflect in the principles of epidemiology. So by study, we said epidemiology is a study concerned with scientific, systematic, and is data driven. Okay, so you need to get your data, you follow a systematic approach, collect data from the field, you summarize your data, you analyze giving the appropriate statistical tool, you come up with result, you interpret the result, you discuss the implication of the result, you come up with a useful conclusion, you now profile solution or recommendation regarding how to control maybe a particular disease. So it's a study. Then epidemiology also tries to describe a disease in terms of distribution, which is concerned with frequency and pattern of health events in a population. So by distribution, frequency deals with number of health events, such as the number of cases, incidence rates, prevalence of health events in a study population, while the pattern occurrence deals with event by time, place, and person. And the pattern usually is classified into two. We have the time pattern and we have the place pattern. The time patterns usually tell us when did the disease come up, while the place tell us where. Okay, so the time pattern tries to explain the annual occurrence, seasonal, daily, hourly, weekly occurrence of the particular uh, infectious disease. Then the times of occurrence of disease constitute its temporal distribution, while the place pattern tries to tell us about the geographical variation. It could be between urban setting and rural setting, tells you which of the two, where is the disease more prevalent in comparison to the other location. Then it tells us more about the location or sites or school where you get this more prevalence of this disease. And here we say the places of occurrence comprises its spatial distribution. Okay, while the person or animal characteristics include such as the age, which particular age group are more susceptible to the infection, the race, is it the Africans, is it the Asians, is it the Americans, and or is it the Latin Americans. It also tells us the sex or gender that is more predisposed or susceptible to such a disease. It tells us more about the marital status of the host, socioeconomic status, behavioral and occupational habits of the persons involved. Then the definition also highlights determinants. By determinants here, we mean the causative agent or the risk factors associated with disease. And usually we call them health determinants. That is the interaction of the pathogen, the host, and the environment. Then the definition also highlights health-related states or events which is concerned with public health problem or event investigated such as environmental exposure, infectious diseases, injuries, non-infectious or chronic diseases, natural disasters, war, bioterrorism, etc. Then in the definition, it also highlighted specified population. Here it is concerned with the target population at risk, e.g., is it the community or animal subgroup that are more susceptible to infection? It tells us more about the region or the global or continent that are affected by such infectious agents. Then finally it also highlight an application. So here we talk of the application effectiveness in order to eliminate or control such infectious diseases. So here you apply the knowledge gained from the studies to control and prevent diseases in community or animal population. And this is one of the core principles of public health, as we discussed earlier. Okay, so you can see the definition really highlights very, very important principles of epidemiology. So now that we know what epidemiology is, let's review some key terms commonly associated with distribution of infectious diseases. And the first one is an epidemic or outbreak. We say this is a disease occurrence among a population that is in excess of what is expected in a given time and place. Sometimes the two are used interchangeably. However, an outbreak as an epidemic is limited to localized increase in incidence of diseases, e.g. at village level, town, or in a closed institution. However, epidemics occur when the disease spread rapidly maybe to many places. And usually it's a tough call for public health officials to declare an outbreak or epidemic at the local government level, the state level, or the at national level. Okay, it can be declared depending on the location where the outbreak is observed. Then the second is sporadic. Sporadic, this is disease occurrence that usually occurs infrequently and irregularly, in which a single case is enough to declare an outbreak. The third is an endemic, which is disease is one that is consistently present in an environment at all times. The term endemic is also used to refer to a normal or usual rate of disease. Okay, and usually terms associated with endemicity of disease could be classified as one hyperendemic versus holoendemic. We also have hypoendemic versus mesoendemic. In the case of an hyperendemic, it is used to refer to disease which is consistently and persistently present in a population at a high rate of incidence or prevalence, which equally affects all age group of that population. Okay, it occurs at a high persistent rate and equally affect all age group of that population. A typical example is dengue fever. Irrespective of the age group, whether young or old, is equally persistent in all group. Okay. Then, in contrast to hyperendemic, we have an holoendemic, when essentially every individual in a population is infected, although the symptoms of disease do not appear equally across the age group. The young are more likely to express pathogenic responses, while the older host will carry the disease asymptomatically. or with reduced damage due to what we call adaptive immunity. Okay, a typical example is malaria. Mostly you find out that in Nigeria, malaria is more prevalent in the younger age than adult age. And this is so because the adult age over time have developed some form of adaptive immunity. Okay, all right. Then we have on hypoendemic. Hypoendemic is a disease that is constantly present at a low incidence or at a low prevalence. Usually, it affects a small proportion of individuals in the area. Okay, and a typical example is like the bilharzia, or we call it elephantiasis. We have the onchocerciasis, or we have the zoonotic leishmaniasis. They are all hypoendemic. They occur at a very low incidence and prevalence, usually within a small proportion of individuals. Then we have mesoendemic, where you have moderate, very low cases of infection. Okay. So, however, like for malaria, depending on the region and the level of severity, different diseases have different criteria for naming them: hyperendemic, holoendemic, hypoendemic, mesoendemic. And the whole of these four can be applicable to malaria depending on certain criteria. For instance, in human medicine, epidemiological classification of malaria could be based on the level of pathology on the spleen. Okay, when you have a level of splenomegaly, there's maybe in the whole population, if it's above 50%, then you may classify it as hyperendemic. Where you have most of the adult population, their spleen size based on the pathogenicity of the disease is less than 50%. Okay, then you may classify it as alloendemic. Okay, so depending on the criteria, okay, so you can read more on this. I'll definitely ask. Okay, then the last one, in contrast to epidemic, is pandemic. Pandemic is an epidemic that affects several countries or continents. Okay, affects several countries, continents, and a typical example is the avian influenza of 1918 that affects almost all the world. Then we have another outbreak in 1857 stroke 1858. Then we have AIDS. We had AIDS pandemic in 1988 to present, and currently we are faced with coronavirus disease, strain 19, which is what we are battling with at current. Okay, so and for pandemic, the only authorizing body to declare a pandemic is the World Health Organization. Okay, you can't declare pandemic at national level. At global level is only the World Health Organization that declares a disease as pandemic. Okay, all right. So what are some of the role of epidemiology in public health? Epidemiology in public health practice aims to discover the agents, host, and environmental factors that affect health. Secondly, they determine the relative importance of causes of illness, disability, and death. Then, three, they try to identify those segments of the population with the greatest risks from specific causes of ill health. and to evaluate the effectiveness of health programs and services in improving population health. To solve health problems, epidemiologists use the public health approach, and specifically they do this by collecting data, conducting an assessment, doing hypotheses, testing, and taking an action. We will go through the boxes on the far right of your screen, one after the other in greater details to show how an epidemiologist implement these steps. First, data are collected about health problems occurring among the population through public health surveillance, as we discussed earlier, right? Then the data collected include information about when and where the population was affected and who was affected by the condition under surveillance. This is time, place, and person. Okay, and this is known as mostly we call it descriptive epidemiology. We shall talk more about that later in the course. Then next, epidemiology establishes inferences based on these collected data and draws initial conclusions. Okay, then thirdly, they use the information to generate hypotheses about what might be the causative agent for this public health problem. Then the how and why of the condition is now determined by conducting tests or studies to test the hypothesis you have developed. Then this determination of how and why is known as analytic epidemiology. Again, we'll cover a little bit more about this later in the course. Okay, distinction between descriptive and analytic epidemiologies. Then finally, the epidemiologist takes action. In public health, this action is often known as intervention. Okay, we intervene to either prevent the disease or condition from spreading or continue to occur or promote healthy behavior in the population. Okay, the epidemiologists recommend implementing some form of actions at the population level. Okay, so let's look at what does an epidemiologist do compared to a clinician. What is the difference in these two views of an epidemiology? Although the epidemiologist and clinician are both concerned with an occurrence and control of disease, they differ greatly in how they view the patient. By now, you know that the epidemiologist, as per definition, he deals with population or community level. Okay, his patients usually people at the population or community level. He frames the question or hypothesis as to what actually is the cause or what is causing the outbreak. He further investigates and draws conclusion, recommendation, and later he evaluates the recommendation in form of program or intervention to see whether the intervention is effective in trying to eliminate or minimize the outbreak. While in the case of the clinician, he deals with individual patient based on the patient personal history. He then conducts examination and makes a diagnosis Then based on the diagnosis, he proposes a treatment and then follow up the patient to see whether there's improvement. Okay, where there's no improvement, he may now propose another treatment. So these are basically the major difference between the two. Okay, so here we'll be looking at the establishment of disease. In other words, determinants of disease or causal components. And this causal component can be classified as the agent, the host, and the environment. Okay, the three interact together in order to establish a disease, the presence of a disease. Here we say disease is caused by multiple factors, and the factors are determinant of disease. A determinant is any characteristics that affect the health of a population, and usually the knowledge of this determinant they facilitate or help us to identify the categories of individuals that are at a particular risk of developing a disease. And thus, determinants are usually classified as those of the host, the agent, and the environment. And in other words, they can also be called the epidemiologic triads. Okay, so we're going to look at some of the intrinsic or extrinsic factors of these determinants and how they uh, come together to establish the presence of a disease. So, some of the intrinsic factors and extrinsic factors that influence disease establishment in the host include factors like the age of the host, the sex or gender, whether male or female, okay, and race or breed, custom, religion, occupation, the genetic profile, marital status, family background of the host, previous disease record, and the immune status of the host. All these are both intrinsic and extrinsic factors that could predispose individual to disease or severity of a particular infection. Okay, for instance, when you talk of age, when you look at the case of malaria, mostly malaria is more prevalent in younger age than or higher age. And when you talk of sex or gender, there are some diseases that are more associated with the opposite sex. Some may be more prevalent in females, some may be more prevalent in male. For instance, when you talk of, for instance, prostate cancer, you know it is mostly associated with what male. But when you talk of breast cancer, it's mostly what influenced by gender, which is female. Okay. And then when you talk of race or breed, some diseases tend to be prevalent in a particular race than others. Like non-infectious chronic disease like diabetes mostly is more prevalent in the Western world as compared to people in Africa. Yes. Then custom, religion, occupation, all these they play a specific role in influencing disease establishment in the host. Then the second factor is agent. The agent here deals with the pathogen or the causative agent. Okay, and agents are biological, physical, and chemical factors whose presence, absence, or relative amount, whether they are too much or too little, are necessary for disease to occur. Okay, an example of biologic agent like the microbes, that is the bacteria, the viruses, the fungi, the mycotoxins from algae, all these they are biologic agents.
Then the chemical agents like poison, alcohol, smoke also are responsible for disease outcome. Then physical agent like trauma, radiation, fire. Then we have the nutritional agents, lack of exercise, maybe lack or excess of a particular food diet, maybe excess of protein or lack of protein, all have their health implication. Excess of carbohydrate and less of carbohydrate. Okay, then we have another agent like stress. Stress also predispose individual to disease establishment. Okay, then environmental factors, the external conditions other than the agents that contribute to disease process. And environmental factors can also be physical, biological, social, economic, or political in nature. And can also be biotic or abiotic. For instance, temperature, humidity, altitude, crowding, housing, neighborhood, type of water you drink, milk, food, radiation, air pollution, noise. All these are environmental factors that influence disease establishment in an individual. Okay, and you should also know that causal factors rarely act alone. They work together, they interact together for a disease to be established.
All right. So now that we know what an epidemiology does, let's turn now to the sources epidemiology used, the method they use to collect data. Where do all of the data come from that epidemiologists used, and how are they collected? Here are some method and example for each of the main sources of data. Uh, the first one is that we often collect data from individuals by using questionnaires and surveys. Okay, for examples, you may conduct household survey, collect demographic data from individuals regarding maybe their health condition, whether they exercise or they don't exercise, how often they collect vaccination against a certain ailment, or why and why not they don't want to collect COVID vaccination and what have you. So such information can be gotten at individual level using questionnaires and survey. Then environmental data. Usually these are collected in multiple different ways. For example, an epidemiologist might collect samples from a river to test for the presence of certain toxins. Then three, healthcare providers collect a considerable amount of data and record these in clinical records, which can be used or accessed by an epidemiologist. Then four, data from non-health related sources such as financial and legal records can also be gathered and reviewed. An example of non-health related sources that can be used to provide key data to public health include, for instance, information on cigarette smoking or cigarette sales, or record of intoxicated drivers arrest and others. Then or record of uh, sexual maybe promiscuity, or record of condom sales. All these can provide an essential data to public health practice. Then fifth, after data are collected, as we've mentioned, then hypotheses are tested Then trends are evaluated and factors between or among groups are compared. Okay, by conducting different studies, like epidemiologists are attempting in different ways to discover if a causal, they try to uh, establish if different ways, if a causal association exists between an exposure and a risk factor and a health condition by making comparison of factors between group. Okay, but to test this hypothesis, there are different study designs that are usually used, and these are experimental and observational study designs, which will be our topic of discussion in our next class. Okay, uh, so all right, thank you for your patience, and kindly post your questions on the WhatsApp platform, and inshallah I'll try my best to respond appropriately. Thank you. Have a nice day.